And welcome, everybody, to our daily COVID by the Numbers program here on ABC 15 Facebook Live. We want to thank all of you for joining us once again. Every day we go through the numbers with our data expert, Garrett Archer, looking at the tips and trends that are happening in the state of Arizona right now. And I guess, Garrett, we should probably start with our daily numbers and just sort of look at where we stand right now.
Yep, let's just go right into it. Number of new cases today, 604 new cases. Our total for the entire pandemic, 222,538. 20 new deaths added today. That brings it to 5,733. And this is off of a diagnostic test number of about 7,300, giving us a simple percent positive, 8%. But when you look at the last 7 days, it's only 5%. So there was some backfilling going on today. About 25% of the cases and tests were added from more than 7 days ago, and the deaths, about 5 of those deaths came from August and July. So this is what we're looking at. We're looking at a slight increase in case numbers and test numbers, as well as a decrease in the average of death numbers, and this has been consistent for a couple days now.
And the death numbers have been pretty steadily declining, right? Some of these deaths can be traced back months in some cases.
Yes, and I'll show you really quick where you can see that on this. Eventually I'll get to my actual curve, but you can see now, in order to look at this properly, of course, we always sort of ignore these last couple lines because they're not fully filled in yet. But as we get to, let's say if we start at the end of September, you can see it's been fairly level, just one little bump right there, but still significantly lower numbers than what we had in even May or April of the beginning of the pandemic. So our death numbers do continue to trend downward.
Do we know what that's attributed to? Is it more cases in a younger population that is not necessarily going to need to go to the hospital, or not necessarily going to suffer any serious complications here?
Yes, I think that a lot of it has to do with that. We are seeing more cases coming from the younger demographics. And we're not seeing as many cases in long-term care facilities and congregate settings across Arizona, and those are the most at-risk people in the state. So since we're seeing sort of that combination of things, and we're not seeing that high of a spread, I mean, our RT numbers, everything is suggesting that our case counts are going up. The disease is increasing in Arizona, but it is very slow. And we're not seeing it sort of impacting the most at-risk population at higher rates than the other demos.
I know when Governor Ducey held his last briefing, which was the week before last, he said anticipate an increase in case numbers. Part of that due to increased testing. Am I incorrect in that?
No, you're not incorrect. There has been increased testing. I'll take you over to the I'll go to the diagnostic testing right here. A little hard to see this one. The curve is a little smaller, but this is the diagnostic test. I'm going to bring this to week, so it's a little easier to see. And you can see we had, obviously, this is the peak of the pandemic when most of the tests were done. We have more than 100,000 tests a week during this period. But you can see a pretty aggressive increase from our low of July 22nd all the way to August 5th of 66,000. And then August 12th, you've got 63,000 right here. So, well, that's actually kind of strange. Let me refresh this, because those highlighted numbers I just gave you could not be where it was on the curve. So let's look at that one more time. I do apologize for that. Sometimes things like that do happen. Let's try this one more time. Yes, okay, this is much better. So, but you can see our low of September 6th. That makes much more sense. And then we see an increase to 66,000 tests for the week of September 20th. Slight decrease to 63,000 so far for September 27th. But we have seen an increase in testing, no question.
When we look at some of these different tests and so forth, that's not the only indicator of spread. A lot of times you'll see the increase in cases, and you'll see because of the increase in tests, but there's some other numbers that we look at as well. Hospitalizations is one of them, and in that category, as I understand it, we're starting to see a little bit of an upward trend.
There is an upward trend in hospitalizations. I'm going to go to our bed count numbers, which are right here. I'm going to stick with the COVID-19 specific numbers because it's a little easier to read. And these are the inpatients, so the general acute care beds. And you can see we sort of hit a low on this around the end of September. at about 472 on September 20th, and we've climbed to about 681 COVID-19 patients since then. So now, obviously, when you look at the beginning of the pandemic, these numbers, even the 681, is still lower than most of the numbers we've seen in April. So we are not where we were at the beginning of the pandemic, but we're also seeing an increase. So very important to notice. And also this increase is with the ICU beds as well. These lag about a week from inpatient. So the low is on 926, and that was about 115, and now we're at 147. So we do have an increase there as well. Go ahead. Sorry.
Well, when we see, we can see day to day there, numbers can go up and down day to day. What you really want to watch for here is the trend. Now that we've had, it looks like several days where we've actually seen a slight upticks in hospitalizations. Can we say at this point that it's a trend at this point, or is this still sort of in the anomaly category?
Oh no, not at all. We're definitely seeing an upward trend in our hospitalization statistics. I did see someone ask about them being double counted, and these particular metrics, this red bar, there's no chance of this being double counted. This is a bed count, so there's literally some people going around hospital systems, and they're going around and actually counting the beds that are being used for COVID-19 patients. So there's no situation in which you're going to have a double count for this respect, because we would see it. We'd be able to find it in the hospital bed count, the census cap. So that you're not going to find that here. However, as I said, there certainly is an increase right now. Not where we were in April quite yet. So still, the numbers are still good. They're just going up.
And they're just sort of creeping up too. Like in April and in May, when we had that reopening, we saw the big spike. Those were dramatic increases. We're not really seeing dramatic increases in the number of hospital beds.
No, not even in the inpatient. You would expect the inpatient numbers to go up more dramatically. Well, at least even the actually, let me just go to the emergency room department numbers, because you would expect them to go up first. Now, there is a data error on these numbers, and that's, I'll show you where that is. This is on 9/21. You can see this massive sort of drop off a cliff here, and that's a data error from one of the hospital systems. But so if we start here on 9/22, where we had 701, you see it's a very, very slight increased trend in the emergency room department numbers, but it's very, very slight. So this is why when we talk about our RT number and sort of where everything is, we definitely can say that things are picking up. But again, it's a very slow creep.
I want to make a distinction, though, when people ask whether cases are double counted versus whether hospitalizations are double counted, because we know that somebody gets a positive test, they may get another test at some point, either to confirm that initial positive, or they may get one, say, 10 or 14 days down the road to see if they are still positive, which is a measure of whether they're infectious and they can come out of quarantine. Are there mechanisms in place, the county and the state level, to make sure that if there's one case, but that person has, say, several positive tests, that that's still counted as one case?
So yes, there are mechanisms in place, and there are, at the initial stages of a case being added, there are possibilities that a duplicate case is in existence. So you have to think about this as like a medical billing system. So someone goes to an urgent care, someone goes to wherever and gets a test, it's flagged positive. It then goes into the MedSys system as a positive. If they take another test somewhere else, and it goes positive, say they're taking the antigen test, for example, which are the faster saliva tests, they take it somewhere else, that's also going to go in the MedSys system as a positive case, but then the EPIs are going to get a hold of it. They're going to know, just based on the person's vitals, their social security number, name, address, all that stuff, that this is a duplicate case, and then they're going to remove the duplicate. And we see that every day. We see numbers going down from like 3-4 weeks ago. One day loses 10 cases, 11 cases. So it's very common to see deduplications going on.
There have been a couple of questions I've seen in the comments section about how the uptick in hospitalizations and the cases, how that relates to schools and what we're seeing in some schools. And there's one question there about Mesa schools. Mesa is the largest district that we have in the state. In that particular case, we know that as of last week, we had confirmed with Mesa they had, I believe, 15 cases that have been discovered in schools. That was spread across about 9 different schools. Most of those at Mesa Mountain View High School. But on a district basis, we should point out to folks that we are not seeing districts directly report to the public, at least, cases that they have in schools. And so we're sort of left with looking at zip codes, and I believe the county also, Maricopa County at least, breaks it down by school districts and how many cases they're seeing there, and they measure a few metrics in that case. But we don't know specifically in specific schools and specific districts exactly how many cases they have, because while those numbers are reported to the county, they aren't necessarily reported publicly. Correct?
Correct. So we do have a couple districts, Gilbert Public Schools come to mind, that actually do give a list of all of the public schools. What I'm showing you right here is Maricopa County's dashboard does now track the number of outbreaks in schools, whether that school is open or closed, and how many students and staff at those outbreak schools are impacted by COVID-19. So as you can see right now, 15 schools in Arizona have reported having at least one COVID-19 case, and of that, 45 are students and 14 cases are staff. And they do change this number every day now, so we can see it. In fact, today it went up about one school and 2 cases. So we are seeing slight increases in the schools, but I've only been tracking this number for about 5 days now, and I haven't seen it go up like by leaps and bounds quite yet. So,
but we should note that tomorrow, I believe, is the day that the county updates those school district numbers on a weekly basis.
Yes.
And so, and they'll show you what the previous week was as well, so you can kind of see whether it looks like cases in your district are going up or down, and that's really the best indicator that we have, right?
Yeah, and I've got that up right now too. This is the Maricopa County map that we spend a lot of time on. This is going to be updated tomorrow in the morning, in fact, and so it does give us sort of case counts in the jurisdiction of the school district. It doesn't tell us anything about the number of, if any of these cases are related to students or staff at any of the schools in the district, but it does tell us what the case counts in the and the percent positive rates are in that particular school district. And again, this will be updated tomorrow.
So the one you had up there was Mesa, I believe. And when you look at these different numbers, cases per 100,000 people, percent positivity, and you look at the previous week, it does look like the numbers are going a little bit, going up a little bit, at least in a couple of the categories there.
Yes.
But they're still in the green to yellow, which means that they can still go with a hybrid model.
Yes, and that's exactly right. You do have some increases. In fact, there's increases pretty much across the board in most of the school districts. Most of them are very slight, but as you said, we haven't seen percent positivity rates go above that 7%. And excuse me, in order for them to be put back into the virtual category, that positivity rate has to go above 7%. And we haven't seen that quite yet. Again, slight increases in case counts, but positivity rates. And this is, again, because of the school, simply the number of tests are being done. There's just more tests. Here's one right here. Cave Creek looks like it's just under the positivity rate, 6.27 in their last update. So we'll see what happens tomorrow with Cave Creek.
Emma asked what will happen if numbers keep rising. I would guess that right now the governor seems to be holding steady on the restrictions that are currently in place. So right now restaurants, I think, can go 50% capacity, still telling everybody to wear a mask in public. Most of the county mandates, I think, are still in place. Correct me if I'm wrong, I don't think any county has actually removed the mandates at this point.
I know.
But realistically, if we were to see a dramatic increase, I guess we would assume that the governor would take action and perhaps put some additional restrictions in place. But it really kind of depends on, I think, where we're seeing those increases and what's causing them. I mean, initially, the governor seemed to take a lot of action against places like bars and restaurants that weren't necessarily following the rules, leading to this uptick in cases. But if we were to see that in schools, for instance, and we were to really see dramatic increases in schools, one would assume that at the state level, there might be some action here.
I don't disagree with that. If we started to see, especially if you're seeing mass community outbreaks, if you will, in different schools where numbers are rising in these particular jurisdictions, you would presume that someone would take action. These schools are free. These school districts are free to make their own decisions. These what we're looking at are essentially guidelines. In fact, I think it was someone told me that Tolleson said they're not going back until January, Tolleson's right here, and oh no, that's Saddlebrook. I'm sorry. I don't know where Tolleson is, but I know where Tolleson is, but I don't know if it's a high school district or okay, sorry. Anyway, since I'm having trouble finding Tolleson, my understanding is that they said they're going to go back in January, although that particular school district would likely be in the yellow at this point, because most of the school districts are in the yellow.
Dana's got a question that we've got up at the bottom of the screen here, and we've had a couple of questions about Paradise Valley school districts. They are starting back up tomorrow. If we can maybe find the Paradise Valley and maybe direct Dana and some of the other Paradise Valley parents to where they can look at what the numbers are in Paradise Valley, and you've got them up there.
The link here is, we can put the link up. Producer Carrie can put it up. It's the gis.maricopa.gov, and this is where you would go to check these directly. You can see, there it is, gis.maricopa.gov COVID schools. And this particular district, Paradise Valley, it's been fairly level. It went up just a tiny bit from 29 to 33, but the positivity rate, it was essentially the same. So very little changes in Paradise Valley from week over week at this point.
And so they're cleared for hybrid at this point. While we're on the subject of schools, I know we had been looking at some of the numbers for the Queen Creek School District. There's been a lot of talk about Queen Creek. We've done some reporting in that district as well, just some concerns about rising case numbers and percent positivity and that sort of thing. Do you have that up there right now?
Yeah, so Queen Creek,
we're looking at?
Queen Creek is experiencing a pretty significant increase in cases per 100K. The school district, and this is from a couple weeks ago. So tomorrow's recalculation will be interesting. But right now they went from 37.8 in about 3 weeks ago to 73.35. So they effectively doubled their cases per 100 in that district, as well as that zip code 85142. And what's interesting about that particular zip code is, while in many cases, when we look at sort of zip codes and places where we've had increased numbers, we are able to sort of discern what is happening in that zip code based off of what could be in that location. Like 85281, for example, is ASU. 85009, which I know I spent a lot of time with right here. This has gone up as well, and that's the Lower Buckeye Jail Complex, which is a major congregate setting where a lot of tests took place. Queen Creek, this zip code 85142, it's gone from 19 to 61, so it's tripled its case numbers, and I don't know what is down there that could be causing that. That would be a congregate setting. So that leads me to believe, unless I know that there's a congregate setting out there where mass targeted testing happened, to me, I have to presume that there's some sort of community spread going on. It's one of those, you need proof to say that something isn't happening. And right now, I don't know what's going on in 85142.
Yeah, and in Queen Creek, we should note that this was one of the school districts that went back pretty early in general. I think they returned August 17th, if I'm not mistaken. And at the time, there was a lot of concern. They had quite a few teachers just say, I'm not going to school, I quit. And they ended their contracts, went somewhere else. And there was a lot of concern that they were moving too fast and opening too soon. That was 6-7 weeks ago now, at least. So, and we didn't see necessarily the increases initially in that district, but now it appears that we're starting to see some increases as well. Are they required to wear a mask in Queen Creek? I believe the answer to that question is yes, that when students go to school, although I think they're doing full-time in-person classes, and by the state benchmarks, they're not necessarily supposed to be doing that. But as you know, the school districts can make the call on their own. The guidelines the state releases are just guidelines, they're not requirements. But I believe that when kids go to school, they are supposed to be wearing masks. That doesn't necessarily mean that kids are doing social distancing. It doesn't necessarily mean that they even can in some cases, because classrooms are busy and packed. But from the reporting I've done in Queen Creek, I think that we are. I believe that's the requirement there, and it's been one we're watching very, very closely because of all of the issues that were initially raised about them opening to begin with. Debbie writes, is there a site to find the school zip code numbers for weeks past for comparison? That's an interesting one. We basically, unless you track it individually, when you go to the website, you're only seeing a couple of weeks, right?
So yes, exactly. So I have this. What she's asking for. I'm still working on getting this in something that I can use to track it over time, but it's not on any website right now. Once they update this site, the numbers go away. So I am tracking it, but let me see. I'm looking at one right now. So just give me 1 second, and I'll see what I have for 85142 from what I perceive to be about a month ago. So this is Queen Creek, and their their confirmed 100K was 22.33 at the time, and so now it's at 61. So it was very level about 3 weeks ago, and so this cases per 100 is quite recent.
A lot of folks putting individual zip codes up there for, and we don't have time to go through all of those, I don't think, at this point, but for people that want to look these up, go to the county website, the county health department website, and then where do they look from there?
They can go to, if it's inside Maricopa County, you can do this gis.maricopa.gov. This is the best place to look at these numbers. As far as the rest of the state, actually, I would, believe it or not, I would suggest at this point going to Mesa's COVID site. I don't know if producer Carrie has that up, or if I gave it to her one time. I do apologize if I didn't, but they actually have a pretty good map of the entire, there it is, that one right there. They have a really good map of zip codes across the entire state that will show what the daily changes look like everywhere. So if you're not in Maricopa County, you can look at that site. And in fact, if you are in Maricopa County and you want to see what's happening the day before, just in the last couple of days, go to that site as well. So it's pretty easy to use.
And when we talk about zip codes, especially when you go on the state website, one of the things that I've noticed is that the state website, their zip code breakdown is, it shows a lot of red. I mean, when you look at the map, you go, whoa, what's going on on all of these different places? And when you look at that map and you look at all of the red on that map, you might go, wow, we've got this huge spread. But they code it red because at some point that zip code has hit 1,000 cases. So these are cumulative cases, not necessarily an indication of what's going on right now.
And that's very much, I mean, if I had one sort of, I don't want to say that it's I guess I would call it a criticism, but AZDHS has been very sort of conservative about how they color in their map. And a lot of times they are well behind the metric as far as what a zip code looks like. And they sort of keep these numbers very conservative. Like, we have zip codes that are almost at 5,000 cases cumulatively, but it's colored red, joining zip codes that only have 1,000 cases. So they're not update. They used to update this every month, and they haven't updated it for about 2 months. And it really shows, because like you said, now we're seeing a bunch of red, and it's very, at least in initial exploration phase, where you're just looking at the different colors. I've got it up so everyone can see what I'm talking about. It's really not that useful. It shows basically red everywhere, but you get, say, for example, 85009, which has, it's probably going to cross 5,000 cases tomorrow or the next day. And then you put that against a zip code right here, 85206, that has only 1,400 cases. These two should not have the same coloring scheme. There should be something that's like greater than 3,000, greater than 4,000, and push this a little farther back. But like I said, they haven't updated this in a while. So
there's nothing on that statewide map to indicate, week over week, for instance, increases in cases or anything. So, you sort of have to track them and say, well, last week they had 3,000, now they have 4,000. That's a big jump. Yeah. But we're talking about cumulative numbers over the last 6-7 months.
I mean, I have all that numbers. Everybody does have those numbers. A lot of people, a lot of analysts have those zip code numbers, but there hasn't been a really good place to put them on the web yet. And so it's sort of, we show it in these sort of scenarios. We show it zip code by zip code, but you're right. There's not really a good place to track week over week changes.
Garrett, I know you can see this question from Mickey at the bottom of the screen, the RT live jump to 1.19, and what does it mean in the context of ICUs being about 80% full, although not many COVID cases in ICU? We should probably establish a baseline for what ICUs normally have in terms of capacity, first of all. You know, take the virus out of the equation for a second. ICUs are normally in that 70-80% range, if I'm not mistaken.
Yeah, you are correct. Most doctors that I've talked to, they've all said, yeah, 80% is where they like to keep ICUs anyway. So that 80% number for these hospital beds, especially when we're coming into flu season, is not a surprise at all. You know, it's not it's uncommon, but it's not unheard of. That I know we're not talking about surge capacities anymore, but there has been times in the past in the normal flu season that Arizona has activated surge capacity in its hospitalizations. So having these numbers, at least the hospital bed caps, is not entirely unheard of.
And we should point out that one of the big concerns, and Governor Ducey has raised this, the state health department has raised this as well, is that when we get into flu season and when that flu starts to spread, that generally starts to spike those numbers a little bit in ICUs as well. And if I'm not mistaken, I think the state is now tracking both influenza-like illnesses and COVID-like illnesses on a data graph as well.
Yes.
But the concern is that when we see the flu combined with COVID-19, that we might start seeing those numbers tick up and start seeing ICUs near capacity, and then we'd have to get into that surge capacity or surge protocol that we've seen, or that we saw, I guess, in June and July.
Yeah, exactly, and that is the concern, and that's why a lot of the projections will show, you know, increases over time, is because, you know, especially in the hospitalizations, because they are also accounting for hospitalizations from influenza. You know, there's a lot of data on that over time, so they can sort of, when they do their modeling, they can figure that out. Now, Mickey, I'm sorry if I said the name wrong, but someone said the RT was 1.19. I don't know where they're getting that number. I haven't seen an RT of 1.19. I have the RT at 1.05. I'll show that right now. It would be a little concerning if it's at 1.19. And if they want to tell me where they got the RT at 1.19, right there, Mickey's saying 1.19. If you could tell me, Mickey, what site that is, I'd love to see it, and so I can compare it with what we have. Because I have 1.05 with RT.live, which is the number that we typically track, and some of the other RT numbers that I look at are around that level as well. So I haven't seen a 1.19 quite yet.
And for people that may not be familiar with what the RT number is, we should just review that for folks. We generally want that number to be below 1, because anything above 1 starts to indicate increased spread.
It is the reproduction number at time t. I know that's a kind of a ridiculous thing to say, but what it is the R naught, and I know that there's been some sort of confusion on the R naught versus the RT. The R naught is the initial estimate of how spread can, you know, what a pandemic spread could be. The RT is what that spread is over time. This is actually the RT, this entire thing. This is just where the last value is. And when I give that 1.05, that's just the last value of the entire RT. So that's why, for example, we never go back and some, you know, I've had some questions of some people saying, well, back in September 9th, you said the RT was 0.8 or whatever it was at the time. And it's like, well, true, it might have been at the time, but this entire graph is recalculated every single day. And so what it ended at on September 10th and what it is now on September 10th is not relevant any longer. So that's just sort of how you have to understand how this graph works.
But it's an interesting graph. It follows the big spike that we saw in cases, and then the big drop that we saw in cases, and then a little bit of a surge. And again, we're seeing these numbers creep back up. This follows some of the other numbers that we're seeing in hospitalizations, for instance.
Yeah, I mean, really today, because we're not having the same sort of lag in the hospitalization numbers, someone was asking for Nevada, so I was just going to go back and see if I can find it. But since we're not seeing the lag in the cases that we used to, this RT estimate is very likely much more accurate to what it should be. I know these are reported numbers they're using, so it's a little tricky, but because we don't have a lag as much, these are better estimates, at least for Arizona. Nevada's at 1.14.
One thing I wanted to get into here, because we're seeing kind of a new wrinkle that could affect some of the data that's coming up here. And this is about a week ago, the governor announced that he would be, or that the state would be receiving a little over 2 million of these rapid, I think, point of care tests was the way they put it. But essentially, it's a test put out by Abbott Labs that allows for results in about 15 minutes. And the governor indicated that those tests were going to be distributed mainly to congregate care settings and as well to schools, and it would be up to counties and schools to determine how those tests are used. And one of there's a couple of wrinkles here that I want to talk about. One of them is that these rapid point of care tests, I think Abbott has 2 different versions of it now. One of them's been used by the White House for a long time, but the criticism of that is that it shows a lot of false negatives. This one is supposed to be more accurate, although there's still a lot of criticism that it may not be as accurate as the gold standard PCR test. But do we have any idea, when we start seeing these tests distributed to the counties and ultimately to school districts and long-term care facilities, that sort of thing, how that's going to affect the reporting of the numbers?
Well, what's interesting about that, and what the concern is valid, what you're addressing, is that who, especially in the schools, these tests are going to be administered by school nurses, staff at the schools, but they're not hooked up to any sort of reporting metric with the AZDHS. So how they're going to coordinate the logistics with reporting these tests, which are not, my understanding is these rapid tests are not required to be, they don't need to be laboratory processed. I could be wrong about that, but if they don't need to be laboratory processed, then these positives do need to be reported to the AZDHS. The long-term care facilities, that's not as much of a problem because most of the long-term care facilities are Medicare certified and have all this medical reporting software and infrastructure is already built into their system. But that's not the same thing that the schools. The schools aren't going to have that reporting infrastructure. So I have no idea at this point how they're going to do that. If they've got a plan in place to report these tests when they come up positive, I just don't know how they're going to do it yet.
Yeah, there's a lot of questions about these rapid tests and how they're going to be used because, as I understand it, at least most doctors feel that if you get a positive test from one of these rapid tests, one of the things that you're going to do then is take another test and take a test to try to confirm that. That's what we saw happen with President Trump. He had an initial rapid test, and then he had to get a confirmation test a little bit later to confirm that there's an infection there. And so I'm assuming that the county's mechanism for not reporting duplicate positive tests would also come into play here. But there's still a lot of questions about how often those initial rapid positive tests are going to then turn into another positive, and how that's all going to be reported in the system, because you sort of weigh the data, don't you, based on the type of tests and what it shows.
Well, we don't have anything in our data that shows whether the test we have is from a PCR positive or an antigen positive at this point. They added a couple of weeks ago, they changed the verbiage on AZDHS's website from PCR to diagnostic, and that happened about 3 weeks ago. And they don't tell us, the only thing we know, the only way to discern what is an antigen test and what is a PCR test is, let me show you. It is on the website. It's really hard to find, but it is quite literally the only place to find it. And it's on the summary page, and you highlight the number of cases and that probable number, 4792. So 2% of the cases, so 4792, that is the antigen tests that are in the system, because the way that the county guidance, or the state guidance works for COVID-19 is an antigen test, as you just said, is considered only a COVID-19 test. You still need to go and get molecular enhancement, which is the PCR test, in order for that probable to be converted to a confirmed.
There's a comment on here from Kimberly Wheatley. Says the next care doctor told us the rapid test we were getting has a 45% false negative. It's important to note, as we mentioned, these two different tests from Abbott Labs the first one was considered probably less reliable than the second one. The second one, which is the one that Arizona is getting, according to Abbott Labs, at least, that's 98, 97% accurate. Although there's still been some questions from other doctors who say they're not so sure that that's particularly accurate. So it's important to discern which test you're getting here first, whether you're getting the older version or the newer version. And the other question I have, and this is probably more for an epidemiologist, but when you have the potential for more false negatives, it seems that whether you get a positive or a negative result, you may want to get a different test anyway just to confirm. I mean, I have to wonder how useful some of these tests are really going to be, because the strategy here, from what I understand, is not to try to test every kid in a school or every person in a congregate care setting. It's more to use it as a tool. If somebody has a positive result, for instance, or if somebody if you suspect that there's a case, then you can do that initial test, and it allows you to move a little bit faster in terms of isolating that person. Obviously, if you get a positive, then that person should be isolated, and you should start the contact tracing immediately, and you don't have to wait 2 or 3 days for a different test. But it still sort of boggles the mind as to how these tests are going to be used and how effective they're really going to be. I mean, it sounds like a great idea. Let's get these tests in schools and so forth, but how realistic they're going to be. Is that just something that we sort of wait and see to see how the counties and the school districts are going to use them?
Yeah, I think you're exactly right. We sort of have to wait and see until there's a press conference with the Maricopa County Health Department, with the school districts. So someone who's going to tell us exactly what the logistics plan are with these tests. Without knowing how they're going to use them and how they're going to be reported, it's difficult to know, how it's going to impact the data and what it's going to do for our purposes of trying to figure out what's going on out there.
When we look at some of these different tests as well, we'll just have to figure that out, I guess. While we have a little bit of time left, I want to get into some of the COVID projections and some of the modeling that we're seeing as well in the state of Arizona and what it shows. When we start to see this increase in tests, we start to see more. We start to see those models creep up a little bit, and those are always a concern. And we should always preface, whenever we talk about models, those models are based on the data that we have right now, and those models frequently change. But what do the models show right now?
So we'll go to 2 of them. We're going to go to the MIT model first, and then we'll go to the IHME model just to have 2 to compare. And this is the machine learning model that I go to frequently. The machine learning model has RRT actually at 0.95, so it's a little lower, but it has been increasing. And here we go with and it does give us a projection. It thinks we're going to be at 0.99. So all of these, this machine learning model does presume, similar to everything else we've seen, that we are going to have increased infection rates, though very small. This one says that right now, the number of newly infected in Arizona is about 3,400 a day, with the total currently infected walking around Arizona at about 50,000. And our numbers actually sort of bear that out when we look at what the confirmed active cases are. And then the total infected, it says about 1.7 million Arizonans have been infected by COVID-19 over the course of this pandemic. And you can see all of these lines, there are slight increases. So
yeah, slight increases, but it's still fairly flat. I mean, that's the good news. It's not showing some enormous spike, and there's nothing in the data to indicate that we're going to see some enormous spike in deaths or in cases, at least in the next couple of weeks.
Correct. This one, for example, this is our cumulative death totals that IHME is projecting, and this one projects all the way up to January 1st. And you can see, for the most part, this one does include a projections, a universal mask, as well as a mandates easing projection. And you can see the divergence there between the 3 on our deaths are 8,100 for universal masks, 10,000 for the current projection, and then 13.8 thousand for if mandates are easing. This daily deaths number, obviously, because you have, this is cumulative, this is daily, they're going to be very different with each other. As you see, it says current projections 42, universal mask 30, and then mandates easing 161. And then here we go on the daily infection rates. This one you can see very interesting. The projections think right now that our excuse me, our numbers of daily infections are going to continue at a level rate till about November 13th, and then they're going to start going down again, matching where it thinks it would be at universal masks by January 1st.
And I guess important to note, what these models project is that if we don't stay the course, basically, we will start to see a dramatic increase, and that's I'm sure something that the governor's office is following as well. That's I think why he's one of the reasons why he's sort of stayed the course on the restrictions that we have in place, and a lot of the counties are still considering those. I understand Maricopa County was going to reconsider, I think, their mask mandate in October, but I don't know the update on that, whether they have decided to continue that. But we don't show any counties at this point, from my knowledge, actually thinking about removing some of those mask mandates in public places.
Correct. I don't see anything like that right now.
There was one question here: how many deaths and how do annual deaths from, say, heart disease and so forth compare with where's the emergency, I guess. When we look at one of the things that you've talked about, and I know we've done some stories on this as well, is that when you compare the number of deaths, just total number of deaths in Arizona last year versus this year, you do see a dramatic increase. And most of the experts say that's because of COVID-19.
Yeah, it's month over month. It's about a 30% increase right now, or it was in July at our peak. So I know what Kane is trying to say, saying that death from heart disease, 800,000, where is the alarm? The reality of the situation, Kane, is that those numbers have stayed relatively within the range of their 5-year average. They have not. There is no alarm because they are within where they should be. It is the COVID-19 numbers, and the sort of the unknown deaths, if you will, that are causing those numbers to increase. At least that's what it looks like right now. So, I mean, over time, this picture will become more clear. But what we have to understand is that it takes a long time for them to confirm and solidify these death projections, these estimated projections. So it will take some time to get this. I'm really, the health departments around the country are used to putting out one report every single year on their death numbers, and now they're being expected and being analyzed on a day-to-day basis. So, you know, we need to basically understand that it will take some time for everything to fully be sorted out as to what is a COVID-19 death, what is a death associated with COVID-19, and then what are the other deaths look like. Death certificates will say, you know, there are cases in which someone obviously dies from COVID-19, but they also died from a heart attack, you know, and that's going to be in both numbers. So it's going to take a while to sort out.
Yeah, and it's important to note that one of the comparisons people often make is, well, it's no worse than the flu. And in fact, you know, 210,000 deaths in the United States in comparison with, say, a bad flu year, which would be 30 or 40,000 deaths in the United States. It's a dramatic increase. So, and we've often heard the CDC say this is 10 times as deadly as the flu, and by year's end, we may hit that 300,000 number, and it would be about 10 times as deadly as the flu. So, it's important to keep an eye on this, and it's important to understand that it's a threat, and you don't want to get it. Even if you survive it, you don't want to get it, because there are a lot of people that have suffered all kinds of complications and so forth. Garrett, as always, I appreciate your analysis. We're going to do this again tomorrow. As always, if you have questions for us, send them to share@abc15.com. We will try to get those answered for you. Thanks to everybody for joining us here, and we're going to keep an eye on the numbers for you.